One of the most insidious tactics in vaccine misinformation is the weaponization of scientific uncertainty. Researchers appropriately acknowledge limitations and call for additional research. That's scientific integrity. But bad actors deliberately distort this appropriate humility into proof that vaccines are dangerous. We need to understand how this manipulation works. Science doesn't operate through absolute certainties. It advances through iterative refinement, with each study building on previous work, testing hypotheses, and refining understanding. No single study is ever definitive. Responsible researchers always acknowledge limitations in their work and call for replication and follow-up studies. This isn't weakness, it's the scientific method functioning exactly as it should. The OncoTarget paper illustrates this perfectly. The authors used appropriately cautious language, describing their findings as signals requiring investigation and calling for further research. This is standard scientific practice when presenting exploratory findings from weak evidence like case reports. But that nuanced, careful language got twisted immediately into headlines screaming that vaccines cause cancer, with the authors' calls for more research presented as admission that they'd proven a link. This follows a well-established playbook. The tobacco industry famously exploited "we need more research" to manufacture doubt about smoking's health effects for decades, despite overwhelming evidence of harm. Climate change deniers use the same tactic, pointing to any uncertainty in climate models as reason to dismiss the scientific consensus. Now we're seeing it with vaccines. The strategy relies on public misunderstanding of how science works. People expect and want certainty. They're uncomfortable with ambiguity. So when scientists honestly acknowledge that no study is perfect and further research would strengthen conclusions, it gets interpreted as doubt about the findings themselves. Confident-sounding misinformation, even if completely wrong, feels more satisfying than nuanced truth. There's also deliberate conflation between different types of uncertainty. We should investigate whether this preliminary signal represents real risk, is fundamentally different from "we've established this is dangerous." But in public discourse, these get treated identically. Both become questions raised about vaccine safety, creating false equivalence between wild speculation and established fact. The psychological factors driving this are powerful. Uncertainty is cognitively uncomfortable. Conspiracy theories offer the appealing illusion of certainty. Everything is explained by malevolent actors rather than complex, ambiguous reality. When scientists say, "the evidence suggests X, but more research would help clarify details," conspiracy theorists hear, they're hiding something. So how do we navigate this? We need media literacy skills to distinguish between exploratory preliminary findings versus established conclusions. When reading health claims, look for hedging language. May, could, suggests, warrants investigation. These indicate early-stage research that shouldn't change behavior yet. Compare single studies to the broader evidence base. A lone paper contradicting numerous larger, higher-quality studies isn't revolution, it's noise. Understand that science's self-correcting nature is its strength, not weakness. The fact that scientists revise conclusions based on new evidence demonstrates integrity, not unreliability. Contrast this with dogmatic certainty that refuses to adjust regardless of evidence. We should also recognize when uncertainty is being exploited cynically. If someone seizes on any ambiguity to reject overwhelming consensus, ask what evidence would convince them. Often the answer is nothing, revealing that their position isn't based on evidence evaluation but predetermined conclusions seeking justification. Scientific uncertainty is honest acknowledgement of knowledge limits. Weaponized uncertainty is deliberate manufacture of false doubt to serve ideological or financial interests. Learning to distinguish between them is crucial for navigating health information in our complex media environment.